Hello, everyone. Glad and thank you for coming to this keynote session. My name is Andrew Pagsisihan, as elated, and very happy to see you guys. But just, taking a quick pulse around the room, how many individuals are providers here? Awesome. Okay, how many are actually clinicians as well? It could be multitask. Awesome, great. How many are here as in behalf of health plans? Okay, all right. And how many are advocates for health care? And I should be seeing a lot of hands here, yeah. Awesome. And for individuals over live, I'm pretty sure you have those participations as well. But I'm here to talk about tech, innovations, as well as, compassion and care. For all care, we believe in actually using both, innovation and compassion to do a high tech as well as high touch to our patients that we serve. Again, serving as a committee board for California State Association for Home Care and Hospice, as well as the national committee members for the National Alliance for Care at Home. Those are one of the biggest things that we want to bestow to everyone, is how can we make this real? With healthcare being so strained, right? We hear it throughout the whole conference. We hear it across the nation. It's like, how can we do more with less? We see the physicians, numbers kind of declining as well. They may be even part of the healthcare system as service as well. But what do we do with the current technology and the current, you can kind of say, silver tsunami coming down the pipeline? Over in all care, we see everything from pediatrics all the way to the end of life, at post-acute at home. And we know that what the most comfortable places to be is actually in your own home. And those are one of the things that we really want to bestow into healthcare, is how can we get ahead of the curve? How can we get the hospital at home, skilled nursing at home? Again, we know that's a high cost, center for everyone. But also, how do we use technology to really be pre-acute versus post-acute? Again, we see a lot of devices out there, fantastic. It's great, biowearables, telehealth, as well as having face-to-face conversations over the web with some specialists, right? Because again, the previous panel said that time is money, but also, as providers, we understand this. But let's flip it on its head. The time of our patients are also valuable. And how do we make that real? But also, how do we make that understandable? To relate to the story for this is, especially in technology, we have biowearables, telehealth, that's great. It's all data, right? And sometimes too much data is noise. And how is that comprehending down to the patient level, right? And that's one of the beautiful things. We had one patient who has diabetes, as well as cardiovascular issues. We're able to take a look at, hey, there are some issues here, and be pre-acute. Hey, go ahead and talk to that patient and say, what have you eaten? Blood sugars come up. They may want to celebrate a birthday with their grandchildren, right? And that may be a blip. But if it's a consistent trend where AI could actually scrub through that data and say, hey, we need to have a different interview with these patients, maybe change a little behavior, and then reduce the hospitalization of high costs, but still provide accurate and patient-centered care. And that's the one thing that we really want to see, is how can we be that high touch? Data is great. Let's go beyond that, right? We know fall's an issue. Things are very susceptible after that. But how can we make that real for the patient? How can we have them in the driver's seat? And the way that we do this at All Care and the National Alliance of Care at Home is talking with the patients. Think about it. Time is money, right? Patients go to the hospitals. They talk to their primary care physicians for X amount of minutes, right? But at Care at Home, we're there frequently, interviewing. We have our clinicians out and 2 times a week, 3 times a week, or even caregivers every day that are embedded into these patients at home. Again, that pre-acute of a human touch, as well as using high tech to quantify everything and really reach out. Again, physicians, fantastic job, right? They master of their own criteria. Those are their specialties as well. And there is a need for them. But at the same time, what is underneath the hood? What is driving that patient? What is our lifestyle change that they could really comprehend into it? And these are the individuals who are at the home. That's why we really believe that we really need to get the patient-centered goals into it. But we need to have empathy. And if you don't have that face-to-face, data is just really cold. That's great. We have it. We have these statistics. But when you teach that to the patient, it doesn't really hit here in the heart. What really hits hard is having that face-to-face of what is the goals of the patients in their own words. We've seen patients that have hip and knee replacements. And it's like, okay, what's your goals after this traumatic event or some post-surgical? Sometimes they're going to say, I want to run a marathon. Realistically, probably not, probably so. But one of the biggest things that hits in my heart, I want to be able to walk down the aisle to my daughter's wedding. Again, huge task, but after getting to know that and have that compassion and empathy, our agents say at Allcares, how do we make that true? How do we work with the doctors? How do we work with the health plans to actually get that possible? Because we have to make that the patient-centered goal, right? A lot of noise, but how do we make this real? How do we get that buy-in from the patient to really collaborate versus us just sending them data, sending them stuff? These are the things you have to do. But at the same time, advocate for the patient, but sometimes the patient doesn't want to advocate for themselves. So we have to have that change of conversation. That's why heart is in the home. Everyone we would like to serve would like to be in the home, but how do we make that real with technology? Again, we see this as an accelerator. Take a look at Meta, Facebook and Instagram. Fantastic tool of historical facts. When we go into memory care, go ahead and using that to reflex some items. They went over to a cruise, remember individuals there. Kind of scary at what big data has to done, but if you take these little instances and using AI tools that are kind of semi-free, but how do we get that touching points for these patients? But also add tech as a stack on top of it, and what is the right stack for it? Even going on to that continuum is, even for a lot of our patients, when they go into health plan portals, when they go into the hospital portals, their electronic health records, right? Ideally, especially with the group before me, is how do we get that interoperability where the patient could use one login for their whole health record? Again, it's like the confusion and noise. How do we make it so simplified? Even myself and the National Alliance for Care at Home, we work hard in DC. We pound on the walls. Again, some of our shoes has hold on it because we've been walking up and down the aisles. But those are the things that we have to make true. Not only that we have to participate, but also all of you have to participate as well. But how do we make that message, right? That we need tech, we need compassion, we need innovation to really reduce this cost for healthcare. But at the same time, for our population that we see, is how do we aid them in the tools to make them successful? Taking a look at a lot of things that we do. But again, it's going to go down to that patient level. Have that heart, right? Time is money. But even if you use AI, right, as an overall skill, it will get you to some type of answers. Hopefully it doesn't have any hallucinations, right, where it gravitates towards that other. But everyone here knows what the cases that you need for that actual patient. Right? You guys are the drivers. You're that warm touch. AI and tech is that cold analytics that accelerates us. And those are the biggest things. For us as practitioners, we understand this underneath the hood. But the human element of compassion and empathy and understanding that patient's goals will drive that patient to success in lowering costs and increase that health literacy. And those are one of the biggest things that we have for all care. From pediatrics all the way to end of life, and talking on the palliative side, right? How can you have discussions? Again, data is there. You could have a prospect and future date of expected end of life, but that's a cold touch. how can you have that meaningful conversation, not only for the beneficiary, but also the family to understand? So those are one of the biggest warm touch that we want to have. High tech, high touch. Again, we really want to emphasize this national care at home, is how do we really bestow that? We pound on the hills, we pound closely, but also have your patients advocate as well. What we're so proud for our agency is we're able to take a look at that data, filter it through, walk through the patients and their caregivers on how to simplify their life with using the healthcare continuum, right? But also when they call health plans or doctors, how do we give them key words to say, hey, this is what I need to do, this is my goals, and how do you make it real? Let's be honest here. Sometimes when a patient goes into the ER or goes into the primary care physician, they have a little bit of white coat syndrome, right? Give them some medications. But who's in the home actually checking? At a skilled nursing facility, you do have someone as an oversight, but that's a higher cost of care. But what about the home? What is the oversight for that? You could have these medical carousels and bestow it, but you still have to have that keen eye for it. My previous life is as an engineer, especially for making medical devices. Now being a population management individual is how can we make it successful, right? Not feel like I have beeping machines or other, but how can we have compassion on it, but increase that health lit for it? Again, these are the biggest things that we have to think to ourselves on how do we change this continuum? How do we put the patient at the center of their care, be involved in their care, advocate for themselves, not only towards their own health, but also to health plans from like the previous panel, but also out on the hill, no matter where you're at. But also, how do we create these societies or communities where it's just like-minded? So we could go to the hill and, hey, we need a change, right? And those are the things. Like, we may be in our little towns, we may be part of our little villages as well, but how do we come as a community to add, hey, here's statistical fact through data, and we save certain monies because they're at home, and we go ahead and get forward with it, but also how do we roll it back, right? And those are the things. And in case there's any traumatic events, how can we prevent it? Again, that health literacy is really key. So for me, taking a look at it, if anyone has any questions, go ahead and come up to the mic. But these are one of the things that we have, is what we really want to do. We want to advocate, get some funding over to the states, and take a look at telehealth to reduce that cost. But we cannot do it without your help, without the patient's help as well. So, as far as a big, meaningful conversation, I just want to say thank you, for participating and hearing me on this keynote. But I like to say, pound on the walls, go out there, make it simple for our patients, as well. But again, if you have anything else, I'm also here. But we just have someone over for questions.
Is there a way that we could use AI as a tool to help our patients set their goals so that we can really get to that heart-centered goal, but using the technology to do that? Have you guys looked through that? Have you investigated that?
We have. Again, is taking a look at what are the certain HIPAA rules. There's ambient listening where we could have, a technology that's kind of like having a casual conversation. Really depicts certain items in there, but also what I've learned from the National Alliance and some research over in Harvard and Duke is they could tell certain tones of the patient, if they're like fearful or not. But again, you have to have that baseline. Once you have those items, then it takes all this statistical knowledge, takes a look at everything, and say, okay, here's our confidence rate with it. Now, the added bonuses, especially downstream for other, providers, you could kind of say, like nurses and certified home health aides, is like, okay, what are the next conversations you want to have for these patients? And then you really go down to that path, right? And then once you start losing patients, usually ambient listening technology or AI say, hey, you may have to reiterate this tomorrow or the next day, because you're going down that specific path, but you want to come back to a baseline and say, is it really going to be true? Same time when changing behavior models too. You need to be physically watching there. I was part of a program up north in Washington State where they have all types of sensors. It's great, it's noise, but you have to get to the root cause. You have to get to the patient level. And that's where we're seeing AI and ambient listening.
And how are you dealing with the patient fear of AI? Because a lot of our elders are a little bit fearful or reluctant to use AI in that manner. They don't want them listening in.
So it comes down to patient choice, right? And then how can they put like a little toe? I mean, we have some patients, not a lot, that fully dive in. We have other ones who are, oh my God, I don't want Big Brother, right? The Big Brother attitude, take a look at it. When I did a little bit of overseas studies out in like China and Japan, I was like, okay, there's a cultural, difference. So I want Big Brother looking at it. But I think after taking a look at, let's not use AI first. Let's go ahead and put like bio-wearables. You're currently like pricking your finger, you have to like write it down. And then we slowly go ahead and say, hey, talk to a health plan, of course. Let's go ahead and get you a CGM, right? Let's take a look at these trends. And then you slowly start feeding it. We see a range anywhere from like 6 to like 18 months of acceptance. We're like, okay, what about AI? Then we go into conversation with the large language models and natural language, right? It's like, are they comfortable with it? And then that's, again, is stepping stones. There are certain questions that you could ask the patients, right? And how comfortable and what their perception of where it's going to. What are big brothers, or do you want to keep it internally on your own? Again, we want them to control their own entity. But we start building firewalls or breaking down firewalls as we go through that. And again, it's patient-centered, but they should be in control, but they should advocate and know, not be kind of tunnel vision for it.
That's great. Thank you.
Thank you. Great questions. I know I don't want to have anyone on the web, so that's it. So I want to thank everyone for coming to this keynote. If you have any questions on technology, current technology in the future, and forward stepping, my contact information is on the QR code, as well as you see everything on the slide. Single slide, keep it simple, right? I know, keep it easy. It's like, oh, I don't want to read through the slides. I just want to bring it up. But I want to be in person with you guys. And then individuals over the web, you could also contact me as well, right? Hit me up on LinkedIn, right? That's the best place to actually contact me. For individuals here, we're face-to-face, so you have that opportunity as well. But over on LinkedIn, just Andrew, A-N-D-R-E-W, Pagsisihan, P-A-G-S-I-S-I-H-A-N. And I'm pretty sure there's two names on there, so it should be relatively easy. All right. So I want to thank you all for coming. And again, any questions, go ahead and hit me up and just follow. All right. Thank you, everyone.